James? What's happening?
I'm not sure, Professor. Out of nowhere, this intense, crushing pain suddenly struck me in the chest. Ow! Ouch!
Oh dear. I'm sorry to hear that. How long have you been experiencing this chest pain?
It started about 2 weeks ago.
Do you also experience shortness of breath, dizziness, or lightheadedness along with the chest pain?
Yes, but how did you know about those symptoms?
You're displaying signs of high cholesterol indicating you may have hyperlipidemia. This means there are high levels of fat particles or lipids in your blood.
Ah, but how do you figure that?
Chest pain, shortness of breath, dizziness, and lightheadedness are signs of coronary artery disease. This is often linked to high cholesterol.
Seriously?
Yes, because high cholesterol can clog arteries, raising the risk of stroke or heart attack.
Oh no. So I'm gonna have a stroke.
Not if you can catch the early signs of high cholesterol and take steps to manage it.
Okay. What signs should I watch out for?
I'm glad you asked because I was just about to tell you the 7 shocking signs of high cholesterol. Recognizing these signs early can lower your risk of heart attacks and strokes. Plus, I'll also reveal quick ways to identify these symptoms for prompt treatment. Make sure you pay attention until the end, so you can equip yourself with the knowledge needed to tackle high cholesterol early and effectively.
Okay.
First, chest pain is a unique sign of high cholesterol that's hard to ignore because it feels like an elephant sitting on your chest.
But how does chest pain connect to high cholesterol?
Good question. When there's too much cholesterol in your blood, it can build up on artery walls. This resembles a traffic jam in your blood vessels, leading to a condition called atherosclerosis. This is where your arteries get clogged up. This reduces blood flow to your heart, like a blocked kitchen sink, leading to chest pain or discomfort.
I noticed that my chest pain seems to spread to other areas like my jaws, arms, neck, back, abdomen, and shoulders. Is that normal?
Yes, that is called referred pain. Your brain misinterprets the pain signals from your heart and associates them with other parts of your body.
So what about the breathing difficulty I experience? Do they also relate?
Yes. Shortness of breath and hyperlipidemia is like trying to breathe through a narrow straw. It can leave you constantly gasping for air.
True. Professor, that's exactly how I feel when I struggle to breathe.
Do you know why you're experiencing shortness of breath?
No, please tell me, Professor.
It's because excess cholesterol leads to plaque buildup in your arteries, narrowing them and reducing blood flow to your lungs. As a result, your lungs may not get enough oxygen-rich blood, causing shortness of breath. This can make daily tasks feel more challenging and leave you feeling exhausted.
No wonder I've been feeling tired lately, even though I eat multiple times and haven't done much physical activity.
Exactly. Fatigue is like an unshakable sense of exhaustion, and eating multiple times might not solve the issue. Picture your body as a car needing fuel to run. Excess cholesterol is like low-quality fuel, clogging your engine. This poor fuel quality can make your car sputter and struggle, even if you eventually fill the tank multiple times with good fuel.
So, the high cholesterol is limiting my body from efficiently processing and using the food I eat, right?
That's right. Plaques that build up in your arteries due to high cholesterol are responsible for your fatigue. They decrease blood flow and oxygen delivery to your muscles and organs, leaving you feeling worn out and drained.
Wow. Professor, you sure do know a lot about high cholesterol.
It's nothing, honestly. My cousin suffers from high blood cholesterol, too. So that's how I got to know all about hyperlipidemia. Next is frequent numbness, or tingling. It starts with cholesterol clogging your arteries and narrowing the paths for blood to flow freely, leading to nerve damage. This can also cause peripheral artery disease, or PAD, where blood flow to your limbs gets restricted.
So what happens next?
PAD gives rise to numbness or tingling sensations in your arms, legs, hands, or feet.
Is it painful?
Yes, it is. The numbness or tingling can feel like pins and needles poking your skin, making simple tasks like walking or holding objects uncomfortable. Patients can also suffer loss of feeling in the affected areas, which can be accompanied by weakness, pain, or a burning sensation.
That seems like a lot for anyone to bear.
Well, that's just the tip of an iceberg. Did you know that high blood cholesterol can also lead to eye problems?
How is that even possible?
Hyperlipidemia can actually cause eye problems for you in more ways than one.
Tell me more.
Cholesterol and other fatty substances can build up in blood vessel walls, including those supplying blood to the eyes. This can cause atherosclerosis, narrowing the arteries and reducing blood flow, resulting in decreased oxygen supply to the eyes. This reduced flow can damage small blood vessels in the retina, leading to leakage and inflammation, known as retinopathy. Retinopathy affects the retina, the eye's light-sensitive tissue, causing vision issues. Without treatment, retinopathy can eventually cause permanent damage to the eye, leading to vision loss.
OMG. I don't want to go blind. Please look at my eyes. I hope I'm not experiencing any of these symptoms of eye problems.
No, your eyes are perfectly fine.
Oh, thank goodness.
By the way, I hope you know that high blood pressure is also a symptom of hyperlipidemia.
Oh, really?
High cholesterol can lead to damage of the endothelium, which is the thin layer of cells lining the blood vessels. This damage impairs the production of nitric oxide, a chemical that helps blood vessels relax and maintain normal blood pressure. When the blood vessels cannot relax properly, blood pressure may rise.
Wow, interesting.
But that's not all. Excess cholesterol in the bloodstream can also accumulate and form plaque deposits on the arterial walls. These plaque deposits can narrow the arteries, making it harder for blood to flow freely, thereby increasing blood pressure.
What about inflammation? I heard it can cause high blood pressure too.
Yes, thanks for the reminder. Excess cholesterol can trigger an inflammatory response within the body. This inflammation can cause structural changes in the blood vessels, making them less elastic and more prone to high blood pressure.
That's really eye-opening.
Finally, the last symptom on my list is multiple xanthomas.
What are those?
Xanthomas are like unwelcome cholesterol deposits under the skin, often due to high levels of LDL or bad cholesterol in the blood. They can appear anywhere on the body, commonly on joints, tendons, hands, and feet. Usually yellowish or skin-colored, they vary in size from small to large lumps.
Oh, I understand.
So what steps are your parents taking regarding your condition, James?
I haven't actually told them yet. I'm afraid to tell my mom or grandma.
Come on, James. You have to tell them because your life is at stake.
I'll find the courage to tell them. Thank you so much, Professor.
If you like this video, please share or comment below and watch this next video on the 7 shocking foods could cause high cholesterol.